what are the core pillars for all types of diabetes? And I would say that probably 5 things are in common with everybody. So one is a healthy eating pattern. So you want to eat consistent meals, you want to eat fewer highly processed carbohydrates, and you want to consume more fiber. This is real general, okay? But you want a healthy eating pattern. The things that other people are eating, it doesn't work with for your body as well. Number 2, regular physical activity appropriate for age and health status. If you're a young person, because remember, especially for type 1, because type 1 can affect you at a young person, you want to maintain your physical activity. Now, you do have to learn how to manage your insulin levels so that you don't risk getting low blood sugars. But definitely for all the adults, and especially for people with type 2, you want to make sure that you get that regular physical activity in there, because that is actually very important for helping your body to manage the blood sugar. And number 3, weight management. This is especially important in type 2 diabetes and pre-diabetes. This is a big risk factor for those two. You want to maintain that normal weight. Most clinicians are going to use is going to be what we call the BMI, that body mass index. There's all sorts of complaints about it. So can you have a high BMI because you have mostly muscle? And the answer is yes. But typically, if you're not in the gym and you're not doing push-ups every day, your weight is probably not from muscles. It's more than likely what most people get, and that's adipose. And that's the stuff that doesn't respond as well to insulin. It's more insulin resistant. Yeah, I tell people to use the BMI as a nice gauge. If there's any questions, say you are a bodybuilder, your BMI is elevated. There are ways to actually evaluate to see how much fat you have on your body. Number 4 is going to be monitoring your blood sugar with different home meters, or they actually have these things called continuous glucose monitors, CGMs. These are devices you actually attach to yourself, and they actually just continuously monitor your blood sugar. So they'll tell you when your blood sugar is going high, they'll tell you when the blood sugar is going low. I've had a number of people who received them after we referred them to an endocrinologist and feel like it empowers them to understand what's going on with their body. And it's really good for people to understand what happens after meals. Now that you'll eat something and you'll see your blood sugar rise, and so you now understand. You can do almost experiments for yourself where you eat one food, you watch your blood sugar, and then the next day you'll eat a different type of food, and maybe it's more healthy. You'll see that blood sugar doesn't go as high as it does when you say you're eating a cake or a cookie. It allows you real-time evaluation of your blood sugar throughout the day. And of course, there's also the finger pricks, which I know most people know about the finger pricks for blood sugar, but you want to monitor it on a regular basis as prescribed by your clinician. And then number 5 is going to be your medications when needed. And of course, for type 1s, you're always going to need insulin. For type 2 and prediabetes, there will be certain medications you need. Now, a lot of times especially in the past, the type 2s would start out with pills. And then as time went on, like I said, a lot of times they would wind up going to insulin as well. Now we have some different medications. These are pills as well, what we call the SGLT2s, the injections that are used. They're known for weight loss, but they're actually diabetes medications, the GLP-1s. And so those are newer medications that are available to help to manage your diabetes.